was such a bad guy, and I apologize. I was so harsh, and I apologize. But you guys were great. Okay, so we, have patients who come and visit, and we met to talk privately because Kathy has kind of a rough history. She has 2 rods in both legs.
Both hips are pinned, 4 in one and 3 in the other, and slip discs and all kinds of stuff in her back.
So she and Mom and Dad came. They kind of sat through clinic, and then we went to meet privately. And because we had talked a little bit about the medicine she was taking, because she was in persistent, chronic, severe pain. And so we went and sat and talked about it for a while. And I said, well, I can't do your surgery. You can't come and have this kind of surgery on those medicines, okay? And it was a very rough experience because Mom, Dad, and Kathy all were crying. Because I said the only way out is to stop all this medicine, and you say you have no idea what you're saying because the pain of this. Of your hips and your legs are so unbelievable. You had to quit your job. You had to move back home with your parents.
I was immobile and laying in a bed for 4.5 years on a walker in a wheelchair, and I was taking about 60 pills a day.
And then with very little compassion, I just said tough.
He did.
I said tough. The only way out is you got to stop those medicines.
We went in that room thinking you were such a nice guy.
He came out, he is a really mean little man. Because, and I think I said this, I have had other patients in the same boat.
Right.
And the story of Kathy and her strength and her family support is one of the truly heart-rending stories that I have ever participated in. I've seen it a few times, but still, you deserve tremendous credit, your family. She is a strong-willed person. She is a good person. She has guts that, probably a lot of us don't have. We've had people, and they're trapped in high-dose narcotics for pain. We've had Jill in Portland, who was in a car wreck and had multiple surgeries, and she was on high-dose narcotics and all kinds of stuff. We've had Lance here in town, and he is a plumber, but has had like 8 back surgeries and is disabled and couldn't walk or anything. And in every one of those cases we said, tough, you have to get off your narcotics. And they would tell me, during and after, it was hell.
Absolute hell. What's interesting about that, and just to fill in some of the blanks too, and let me show them. This is the outfit. Can I show you guys? I want to see something. This is the outfit that I wore, and I was really inspired by this when I first came through, so that's why I bring it. But this is the outfit that I wore when I first came in.
I remember you.
Yeah, now you do, huh? So, and
That blue shirt.
yeah, and I have pictures of it too. And I had seen him on TV with the Jill Gerard story from Buck Rogers. I don't know if any of you have seen that. And when I called, because I researched all the other surgeries and said absolutely not. Even in a wheelchair, and even using a walker and laying in a bed, I was like, absolutely not. They'll scare me to death, and they're going to take part of me and throw it out. And when I saw him and the number, and I called, and it was about 7 o'clock at night, and he answered. And I'm like, what? I just got your number off this website. We're the surgeon? Like, I just was like, I don't get it. And he said, come see us. So we were very hopeful. I told him my story, and he said, come see me still, and listen to the clinic. And I thought, oh, great. This is someone that, So it was disheartening when he told me that, but he told me that for a very good reason. And it's something that, to this day, I'm still in pain, that I could go get a script for it right away. But what he's done for me, what this surgery's done for me is so life-changing on so many levels. It's not just that I lost weight, but I know that when you're heavy and you have other problems, and your knees hurt more, whether you've had surgeries or not for those things, your knees hurt, your hips hurt, your backs hurt, all those things. And because I had all those medical issues, I got trapped in a world of being on those pain meds. And looking for another, the solution to relieve me from my pain. And my mental anguish of walking around as an obese person in this world fell to the wayside because I didn't even care anymore. I was just so physically in pain, and then just got to a point where I was ready just to give up on life. I was, I just turned 30 and thought, this is no life for me. So it was a really long struggle, about 4.5 years just laying in a bed before I came to see him. And when he finally told me to get off those pills, he said, come back and see me in a year. You know, you're going to have to taper off those pills and this, that, and the other. And I just thought, I'll be dead in a year. I'll be dead in a year because I cannot live one more day like this. And so on that day, I said, just tell me, what do I have to do? He says, you get off those pills and and we'll talk. So that day I just started taking one less pill. I was on the way home in the back seat driving home to Arizona and crippled in pain, but I'm like, I'm not going to take these pills. And I went off of them in just about 2 months. And I was taking 60 a day. And no one believed me that I could do that. He even wanted to drug test me. He's like, there's no way that you're off those pills. Even my doctor was just like, drug test me, you know, and she wasn't giving me script. She knew, and my doctor at home is great and has been through my whole story, and she knew, and she's just like, you want to live. And I did. I had that fighting spirit that I wanted to live. So I had the surgery. I was full of fear about all the things that my new life.
But remember she had a terrible, terrible week after surgery.
I did.
There's terrible pain because those narcotics, the research now shows if you look at the brain, it changes it. The brain, the narcotics, which are wonderful, you need them for a period of time, but over the long term, the receptors in the brain, the structure in the brain changes. And so post-op, she had terrible pain.
You guys want to see some pictures of me? I'll pass them around if you want. I did, and I want to talk, you know, if you guys have questions too, because I always did. I was a little scared, you know, going into that, and I had this reaction to the morphine, and it felt like all my hair follicles were standing up, and it felt like I had razor burn and a sunburn on top of razor burn. And I was my week after, I couldn't have the sheet on me, I couldn't have the fan going, I couldn't get comfortable. We were talking about it on the way up here, we always do that on the way up here every year, talking about it. It literally was the worst week of my entire life. Even coming off those drugs. And coming off those drugs, I would walk around at 2 in the morning outside and pull out my hair and scratch my arms, and I had welts on me. I felt like ants were on me, and it's horrible detoxing from something like that. And that's how the morphine right away. So for me, that first week was really horrible. Also, my menstrual cycle for the women was completely off. And I remember you telling me this too. And I hadn't had a menstrual cycle for a while. And he said, well, after the surgery, it's like we flip a switch on, and your body just starts working. And I was like, okay. I'm not kidding. That week, I just bled. And I literally didn't stop bleeding. And this might be scary, and you might experience it. That's why I'm talking about it, even though it's, well, you know, humbling and vulnerable to say these things, but I think it's important. And I did. I bled for what, about 40 some odd days straight. And I just didn't stop. And so my body was just going through all different kinds of things. And there were times where I thought, did I do the right thing? You're going to have that fear. Did I do the right thing? Did I make the right choice? All I did and all I could see was me treating in one set of problems for a whole new set of problems. And was this
they're
really,
all my fault.
Yeah, it was all, and I signed up for it, and I said, I said, okay, do this to me. But I had this fear of that I wouldn't lose enough weight too. That's another thing. Here's the thing, also about the bypass and about. I remember saying, I said, well, how much are you going to take? And we're trying to bargain with him, you know, like, well, you're saying 6. How about 8? You know, I kept thinking, I'm not going to lose enough weight. I don't want to have to go through this again. And he says, when I'm in there, he's the doctor. You know, when I'm in there, I'll decide. And he took 7. And I'm grateful he didn't take 8. At some points, people have told me I look too thin, and you know, I don't want to, and I'm afraid I don't want to get too thin now, and I want my curves to stay. I want to stay right where I'm at. Don't let me lose 1 more pound, and that's really kind of how I feel. I never thought I would say that. I always, you know, so I had those complications, and then since, just to kind of speed forward, anything else that I've kind of dealt with that you may or may not deal with, I became lactose intolerant. Not that big a deal. My hair fell out. Now, that's a big deal, especially as a woman. In fact, right now I'm wearing a wig.
I thought you got it cut. Last year this was long and brown.
It was, but I had extensions in or a wig on.
You had extensions?
Yeah,
you did
not, but just clip-in ones. My hair used to be my thing. My hair was this mane before. I chopped it all off and got really, really sick. And it had already kind of started falling out. I can't say it was entirely the surgery. Being on all those medications and pills, I think it did too. But that wasn't my thing. Even as a larger woman, everybody commented on my hair. So when it fell out, I was like, you got to be kidding me, God. Like, that's the one thing I had, you know. And so that was a very humbling experience. And I just decided, you know, I'll wear wigs, I'll wear hair pieces, I'll wear whatever. Because that is so small in comparison to, you know, not having to carry around the weight anymore. Especially on my body with the metal and all the issues. It did grow back. It just never grew back how it used to. And I have all this money invested in all these wigs and hair pieces now, so for me they're kind of like girl hats. So I actually rock my hair, and it's about down to here. It's just in a bun, and I have that wig on today. And I do that sometimes just because, why not? Why not live? Why not wear my
And she
wig?
looks beautiful. Yay!
Why not wear my wig and bravery now and just have fun and tell people, yeah, it's a wig, it's fun. I'm bringing hats and wigs back. Why not? You know. And so those things, you take the good with the bad. You make a decision, you know, which I think a lot of people do. I can't do this anymore. I can't live like this anymore. And then you take the good with the bad. I started having about a year ago.
Well, wait, let me. Can I ask one thing?
Yeah.
Now, I have maybe 4 or 5 people that went through what you went through. And
Yeah.
here's the funny thing that I tell people now, because I use you and Jill and Lance
Right.
as my examples. When I sit and give them the rough news that I gave you,
Right.
I said, I'm telling you something very hard. I know it's very hard, but it's also doable because I've seen people do it. If you think back to when you were taking all those medicines, even though you had all those narcotics every day, you were still in pain, right?
Absolutely.
And am I right when I say after you took off all those drugs, it was horrible and awful, you were still in pain
I'm still-
off all those drugs?
I'm standing here in pain.
That was the key that you said that day. Aren't you still in pain, Kathy? You're taking the drugs, but aren't you still in pain?
Right.
And then when you're off of them, you're still going to be in pain.
still
I
in
think
pain.
that was the key that, she said, yeah.
Because we have a guy who is the brother of a woman that we operate who's a nurse in town to our plastic surgeon. And he has a architectural, gardening, kind of outdoor business. And he was devastated, taking handfuls of Lortabs. He had Lortabs, just handfuls. And I told him, you know, his sister had gone through the surgery. It's done terrific. She looks beautiful, terrific health, everything. So he came to me and says, I can't walk, I can't work. My business is going down. I'm an administrator. I can run my business, but I need to be out there working. I'm going to lose everything. And I said, you have to get off of these narcotics. And he said, you don't understand what kind of pain I'm in. And I said, well, I know I don't understand, but I've taken care of other people who've had the strength, the personal willpower to go through that. And what I think they have told me is once they get off those narcotics, the pain is about the same as when they were taking the narcotics. They just don't have narcotics.
But the key is that the amount of pain right now
It's more
compared to 320 pounds, carrying that around, this is manageable.
It's manageable.
Right.
It's manageable. It was not manageable.
He
before.
took, in other words, I told him about you and Jill and Lance, and he went home. I told you the story. They told you
You
that
told
story
me about
her, right?
Yeah.
I said
You told
she's
me.
the girl from Arizona,
Right.
and he went home with his wife. Together, they got this. They described it as like big jelly bottle of Lortabs. They poured it down the toilet, and they didn't have another one after that. And he's been a big success also.
Here's one thing I might add that I feel vulnerable sharing, but I think that it's important to know. Because I was addicted to food. I mean, was my first addiction of choice, was food. And I never took those pills. I never felt addicted to them, but I was dependent upon them. And the clock would come, and I would wait, and I would be looking, and my body needed that. But I didn't abuse them. But once all of that went away, and I had, you know, some complications, I wasn't. The other thing I wanted to say too was that iron. Well, let me finish this. I personally, because of my own story, and it's a personal thing, but I know for me, I continue to transfer addictions until you deal with the reason you gain weight to begin with. And it's a valid point. It's not the medical stuff that he's going to talk about, but everybody has a reason of why they overeat. And I would just encourage people strongly to have a support system, have counseling, whatever it is that you feel like you need. I personally was unprepared to hear that I was beautiful. I did not, or to have men hit on me, or to start dating, or to have women all of a sudden jealous of me. I had never experienced that in my life. I was just always the funny fat friend. And when you operate in a world as an obese person, and then all of a sudden that's taken away, and the world assumes all these things about you based on what you look like. Again, but it's now because you're thin. It can really mess with your head.
Well, can I tell a story?
Sure.
And this is a really sad story about kind of that same thing. We had a patient that didn't really know she was going to be a patient right away, because in our clinics, week after week, there would be a woman sitting in the back, kind of in a suit, thin, petite woman, and after a couple of weeks, got to say hi, and what's your name, Sue, okay, and just asking questions. And then her husband and she appeared, and both of them sat and listened, kind of. And what they were there for is to evaluate for their daughter. So they brought their daughter in, and very closed, chewing on her nails, dark hair, and looking down and everything, and overweight. And after quite a while preparation, we did the surgery, and she blossomed. She was in high school and had not been out, not been on dates. All of a sudden, she was doing these things in school, going out to parties and things like that. And then she would come back to clinic, and you could see, she melted down, very attractive, happy, outgoing, everything looking great. Parents happy, Dr. Rutledge, you're wonderful. And then at like 9 months or a year, little metal pieces started to appear, like extras here and there. And then a blue streak. And a little over a year post-op, she came in one Saturday night to the ER and died of an overdose of alcohol because she'd been out at a party drinking. And basically, what had happened is she had been someone who didn't have a lot of social opportunities, wasn't asked out, wasn't doing a lot of things, began to enjoy that and didn't have control, didn't understand this new life and the pitfalls of being kind of the attractive girl in our society, and ended up drinking, forgetting about the things we told her because, what does Dr. Rutledge know, and I'm normal and things like that. So we see this, that oftentimes there's this gigantic transformation, and it can be difficult to face that, especially for young people. So
yeah, that's a tragic story, and what's interesting about the surgery, and I don't know this for sure, but I was never a drinker before. I did not drink, I did not smoke, I did not drink alcohol, nothing like that. And I feel in many ways like I'm just going through an entire transformation in my life. And I did start drinking. What's crazy is that with our new stomachs, we don't process alcohol the same way. Well, I never really knew how I process alcohol anyways, because I wasn't a drinker. So for me to have a few drinks and then black out was like, well, I guess that's just how it works. I didn't know. And I really was hurting myself. I mean, driving and drinking, and ended up in the ER with a concussion and broke a bone because I would just fall down. And because what he's done, and if you are a drinker, and that's why I wanted to address it, is that alcohol is now metabolized in your body differently. And whether you're a drinker or not, however it affects you, and if you've eaten or if you haven't, or if you, all the same things that happen when, but it just happens that much quicker. Within an hour, you can be flat on your face. And I didn't know that. I just didn't know that. I was warned that it's not good for you to do those things, but I am going through a process, even at 3 years out, of still trying to maneuver in this new body, to interact with society, and just try and be me in a healthy life. And so everybody's story is different of how you got here. But if I could just say, chill out, If I knew 3 years ago how good I would feel, and how much hope has now been restored to me, I wouldn't have worried so much. And I think a lot of my worrying, and I can't deal with this, and it's too much, and led me to just freak out mode and saying, I give up, I can't handle it. And then I went through all this, and I got these pills and did all that, and now I'm an alcoholic, God, really? Like, I just was like, really? Like, I just couldn't take one more thing. But I stopped drinking and no longer do that.
Did you drink after your surgery?
I never drank before my surgery. I only drank after my surgery. And didn't realize how that would affect me.
A half a glass of wine if I have some with meal, or if I have some before we sit down to eat. Just a little
Half
bit.
glass.
Yeah, because it's very powerful because it's a straight shot in. It bypasses the liver, and
Boom.
it's.
I'm the life of the
And
party
again,
for
just
about
think about
30
this. Yeah, it can be deadly. That's the thing. And the MGB has all these good things. There's a lot of good things, but it's not normal.
Right.
People say, well, this is great. And that young girl, she basically
That's
said,
right.
this is great. I am the thin, attractive member of my high school class, and that includes drinking and partying, and that's not the deal. And it's hard to get that across to people, and it's...
Especially
I
young
don't-
people.
Yeah, I don't miss
And I don't
it.
want to make it...
I don't miss it. I don't crave it. All I'm going to say is I enjoy eating, whereas before I didn't enjoy eating. Eating was, I ate quick, I ate a lot, and then she'll tell you this, and I got on my way. Fishing,
Right.
hunting, skiing, snowmobiling, whatever. I did it all, even when I was obese. But eating was a chore, it was a pain. Now, I'm never hungry. You mentioned if you're hungry, you do this. I crave. I get a taste and I crave. But I'm never hungry. If I'm out on the boat and I go all day and I didn't bring any food, I'll stay out all day. I know you don't want to hear that. I don't do that. I always take stuff with me.
Okay, good.
But I'm saying if I didn't, I'm good. But I enjoy eating now, and I eat whatever I want, whenever I want. And if I want to eat something every hour, a couple of stuffed grape leaves, like I said, that pot lasts 4 days, not 1 day.
Right.
Well, keep it
So,
simple.
Yeah, don't worry.
Is what I would say. Everybody is unique and has their own story. If you don't have a problem with certain things, don't anticipate or freak out that you might, but just be aware. Be aware of your body, your personal circumstances, what your doctor is. Read the workbook, do what he asks when you have questions. I've had a few questions because sometimes I've had an ulcer. And I feel like I was going to die, like something was happening to me, and I was spitting up blood and I couldn't breathe and I was freaking out. Well, I took Prilosec, like he said, for a few weeks, and that went away. It came back a few months later, I did the same thing, and it went away. I've had 2 bouts of it in 3 years and haven't really had an issue with it then. I get my blood work done and see where I'm off. And I actually was really iron deficient, and I became anemic. And that, again, is unique to me, perhaps. It may not happen
About
to you.
5% of people.
But I did
It
my-
happens to our young women who are
Right.
still having their menstrual cycle. And the hot new thing about that is the Proferin.
Right. I
Proferin.
couldn't, we tried through diet to up it, I took supplements, all those things, nothing helped, and finally I had to go see an oncologist, and then I sit in a cancer room with people who are dying, and it just puts it in perspective. I'm just getting iron put in my blood.
Because I'm going back out.
And I'm going back out, and these people around me. So all these little things that this surgery has given me just to sit in that room and put things in perspective in life for me, it's been really profound. It's been really profound, and I just think you need a support system. Don't. If you are starting to struggle with something or transfer it to an addiction, talk to somebody about that, and don't fool yourself, and keep in contact. Keep coming back. I come back every year, and I try
And so,
pass the message.
I would like to point out, this is a very strong lady. We gave you and Mom and Dad,
Dad's
we gave you
here, too.
we gave you a harsh, tough task, and you guys faced it, and I'm really proud of you. It's a
Thank you.
pleasure to see you and talk with you.
And I'm going to keep standing because my back hurts. So,
Yeah.
but I'm done.
Same here, since I lost all that weight. I want to say one thing.
Yeah.
I found my tailbone again.
Yeah.
Thank you.
Since I don't have any butt. And the other,
Sorry.
The other thing, I thought I had a tumor in my chest until I found out after I lost all my fat that the xiphoid process was pointing out.
Yeah, that's his xiphoid sternum.
When you mentioned the bone.
Now we're going to talk about length of life. So I'm going to do another video on this because we almost got there.